Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-hakim, and today we have the sexy, the handsome, the awesome Dr. Ross. Do you know what? I mean, I am jealous of you because, you know, you're bloody handsome, mate. And, you know, us old biddies, do you know what I mean? I've lost my hair. I'm grey all over. I've got, you know, a bit of pounds down there below. I mean, as in like lower belly sort of thing, not sort of other places. But hey, you know, jealousy is a bad spiritual trait.
True. Well, I feel like I should deserve to have less hair. When I look at a lot of my peers, they're balding and stuff. I think I'm doing all right for 31. I've still got a good full body of hair and everything. So, you know.
So what's the secret to you know, nice pair of sort of, you know, hair on top of your head? You know, what's the secret?
I don't know. It's in the genes, isn't it? Is it not in your mother's paternal lineage, or is that more an old wives' tale? I'm not sure, but yeah, I don't know. Maybe I rarely get stressed these days. I mean, I guess stress has a certain amount to do with it, doesn't it? But yeah.
When was the last time you were really stressed?
Oh,
I mean, you know, I'm talking about work here, not sort of relationship, because I know you have. No. I mean, I heard that you've got a really nice Swedish girlfriend, which we'll come to that at some stage.
Yes, indeed. It's probably not actually that long ago. It was probably 2 days ago. I was pretty stressed at work. Speaking with a patient and trying to manage expectations and the sort of challenges for that in a COVID world, where she, you know, quite benign symptom, but wasn't happy that we hadn't explored what it was. And I feel like coming with the emergency doctor mindset that the rotation I was just in, you know, having that spiel of saying, well, we know what it isn't. And the things that it isn't are some really serious things. So we'll see how it goes. But that wasn't enough for her. So trying to stay calm and say it's difficult to know where to take this further, this non-specific symptom, and trying to juggle not wanting a patient complaint, which is something that, you know, all the GPs particularly seem to be very stressed out about often. So
yeah, I mean, complaints are not great, but you've got to receive them on a regular basis, I think, and also deal with them, because it just allows you to change your management appropriately. And I mean, as long as you don't take it personally, you know, when I used to get complaints and I used to get really upset about it, is when I took it internally and considered it part of me rather than part of, you know, my profession and the work that I do.
I mean, I've been lucky or perhaps unlucky, I don't know how to say it, but I've not had a complaint. But I would wonder, even now, thinking I'm got some skin, not completely thick-skinned, but in being able to react in a really kind of detached way and not take it personally, because that would be a real test of character, I feel.
Yeah, I mean, definitely. I mean, I had a bit of an issue at work, personality clash issue, and that happened to be a relative. Can you believe that? I work with relatives in the medical sphere. Okay. Yeah. And because I took it personally,
another dimension for sure.
Yeah, because I took it personally, and you take it personally when it's someone that's related to you and sort of closely related to you. So I took it personally from that side, which hurt me a lot, and that caused a lot of emotional distress for me. But when I thought about it, you know, this is a professional sphere, you know, it's not a personal sphere. but I mixed the personal with the professional, and that caused a lot of distress for me. But once I separated that, I separated the personal from the professional, it became very, very understandable, why they reacted that way. Very understandable.
Right.
So, but then, when we start medical school, we're kind of fed this narrative that this is who you are, this is your persona.
Absolutely.
Going back to sort of depth psychology, we're made of different personas, but we're sort of fed this narrative that the medical persona is the most important persona that you have to develop as a human being.
Yeah, that's a really interesting point. And I think from day one, they're trying to separate you off as having a different persona from the average Joe Blogs. And I think the first kind of real exposure to that is when you have your first cadaver, and that it's really a test of your, they introduce it as your first patient, which I think is kind of pretty macabre and stuff, but actually it's to try and see if you're made of the strong stuff, and it's kind of, it's, you never forget that moment when you go into that room and you see maybe 9 cadavers just out on tables, and how it's so normalized. And there's some, as a fresh out of school 18-year-old trying to, think about what this means and trying to detach that humanity from these patients, it's a bit of a mind F,
mind fuck. So, definitely.
Yeah.
And sort of, how did you unfuck your mind, so to speak?
I think it was at all points trying to forget that they were human in the first place.
Wow.
So I didn't like to be reminded of the fact that they were a living thing at one point. So, if I focused on their wrist and saw still the tan line of where their watch was, or a tattoo or something that, reminded me that they had a story, I found it very difficult then to dissect. One of my friends in our third year, when we were dissecting the head and neck, it was quite challenging, and my friend didn't help by opening the cadaver's eye as I was dissecting the cheek, and I don't know, it kind of got to me. I got the odd nightmare about it, but yeah, I mean, it was just something you kind of just accepted was part of that medical student experience. And I'm not sure how useful it was. I mean, of course, dissection really helps to understand anatomy on a spatial level where textbooks just don't describe that. But actually, prosection probably do that job better. So spending 3 hours dissecting really badly the brachial plexus or something, and then being told, well, what is this? It's like you've gone at it with, like, it looks like a bad dinner, I don't know how, if it really was more the agenda of the medical school to try and do that very thing of just separating you out from the normality, and having that kind of more heightened position, or it's a wonderful opportunity as well. I mean, very rarely in any other sphere would you have that exposure to death and dying, and for it to become normalized. And I think that is good. I think I value the fact that I view death and dying with a much healthier attitude compared to my friends that are in a non-medical profession. So
yeah, I mean, I me coming from an Iraqi background, we see dead bodies all the time. So for me, going into the dissection room was, another day in the office kind of thing. So for others, it's much more harrowing. The counter argument is that you are going to step into a very, very difficult work environment. and you'll be seeing dead bodies.
Uh-huh.
Luckily not as often as, but now with the COVID situation, the things are very, very heightened in terms of death and disability.
Yes. Yeah. Yeah.
Yeah, so I mean, I'm interested. You've got dead bodies here, and that kind of shocked you a bit. Why are you going towards zombies? Because I mean, I'll be honest with you. I love the zombie genre, and I think zombies are wonderful. Because
Uh-huh.
they're so single-mindedness. They're so clear-headed. They've got a single goal in life, and they're very successful at what they do.
Yeah, they really are values to uphold, aren't they? Yeah, true.
They're very successful, and they just keep going for it, and eventually they get there. And I think, wow,
That's the trouble,
so
isn't it?
uncomplicated. Whereas human beings are just so complicated. God knows what's going on inside their head.
Yeah.
So how can you have something against zombies? Calling your whole organization.
Yeah, it's kind of that sort of the aspect of a zombie being completely unconscious and in pursuit of one goal, isn't it? And that one goal being attainment of something at a later point. I'm consciously going through my career because at some point I might actually find it fulfilling, and that unfortunately never really works. If you're spending 4 years in a training program that takes everything away from you, expecting that after those 4 years you're going to feel suddenly hugely fulfilled in something, that moment's just not going to come, because now you've trained your mindset to be in that kind of, not in the present moment, but thinking about attaining something that's missing right now. So you always have that feeling of missing something. So yeah. But yeah, zombies aren't sexy. But that's
come on. There's a few nice looking ones. Come on, and they're up for it sometimes.
Yeah, true.
Well, they're up for it all the time.
Yeah.
Weird.
I think kind of, I think drawing attention to the ugliness of that side of medicine is quite good. So sort of saying, we're all medic zombies, it can feel like an insult, but actually just, I think a lot of people resonate with the fact that, oh yeah, I do feel actually like a bit of a lifeless human in this. I'm very passively going through this whole experience. And actually just calling it out. So not only in the individual, but in the whole system, and how deeply unconscious the system is to our wants and needs and the patient's wants and needs. And it's all kind of a bit backwards in how we're trying to deal with it.
When did you feel, or when did you realize that you were turning into a medical zombie?
I think it was after qualifying, when I was committing to doing lots. I felt like in order to achieve, I needed to spin more plates. So not only was I doing foundation years, I was also being a lecturer for a medical finals company, setting up a program with the BMA in London, and thinking that's how I was attaining success in my mind. But actually it was slowly eating away at my ability to be there for my patients. So particularly in FY2, I went from the frying pan into the fire, going from hospital at home, which is quite a little cushy job position where you drive around to biddies in their houses, and you're providing medical care there, to suddenly being in the intensive care unit and just kind of being overwhelmed by the misery in there, and it led me to, as a sort of protective mechanism, shutting off the humanity in it. So actually I felt that my resilience had to come from sort of shutting off, and that's a bad thing in a doctor-patient relationship when you're trying to protect yourself by feeling the pain of the other person's, because you're already feeling quite a lot of pain in yourself. So that was probably the first point I I wasn't, and again, this is the thing. I didn't have any real insight to that. It's only now retrospectively thinking, oh, actually, I was quite unconscious and burning out a little at that point.
And thinking back, what would have you done differently now that you've experienced what you've experienced in life?
Sorry, bear with me. Technical issues with my iPad falling off there. I think I probably, hang on, you can edit this bit out. I'm currently, this iPad is perched on a picture frame.
A bit like
probably not.
Bit like an FY2, isn't it?
Yeah. Yes, very apt.
Hey, you know, I'm not having to go at any FY2s. I'm just being in awe of your absolutely, you know, amazing work that you do. I don't know how they do it.
Yeah, no, true. Well, I think in answer to your question, I probably wouldn't have tried to spin as many plates. I think that's simply it. Like, actually appreciating the fact that just getting through foundation years is quite challenging. I'm probably speaking out more. I was living on my own at the time, and I would just take the weight of all this back home, and I would just sort of ruminate about it for hours without really thinking about meeting up with friends. I was quite happy wallowing in it a little bit. There's something, I don't know if it's quite a Scottish thing to do, just to be quite happy being unhappy in some ways.
Well, the whiskey helps.
The whiskey definitely helps, especially if it's a good single malt. So yeah, I don't know. But then partly, I know I've been talking about this a lot recently, and actually I'm really, really grateful that I had such low points, and I'm glad that I had them, and I think they were important to have in redefining what it meant to me to be in this profession. And they've been far more character defining than any moment where it's been, you know, pleasurable. You know, like when I was in New Zealand and going on weekend trips, surfing and skiing, it was pleasurable. It didn't tell me, oh, okay, I'm just, you know what, this setup doesn't work. I'm gonna sit down.
Are you doing like the standing kind of, you must stand at the desk kind of BS? It's exactly. A Swedish thing, mate. Yeah. It's definitely an IKEA.
It's rubbing off on me. It's rubbing off on me. But yeah, the sort of yes, those experiences in New Zealand and stuff were really pleasurable, but they didn't make me a better doctor necessarily. So yeah.
No, you're right. You're right. I mean, I experienced not a prolonged, but sort of a significant amount of time of suicide. You know, thoughts of suicide, and you know, not actually going through with it. And really, if I didn't experience that experience, I wouldn't understand clients that come to me with these problems. And I mean, I don't call them problems. I call them experiences. You know, because it's not actually a problem. I mean, it's a problem for society. So society defines problems. But as us human beings experiencing it, it's called experiences for us. But then we call it problems because society, you know, changes our mind about it.
Yeah, and we're so quick to label it as either a good or a bad experience.
And, you know, labeling is a really society label rather than a personal label.
Mm-hmm.
You know, so it does become an imposed definition or a story.
Yeah, and it's easy to feel quite abnormal to then have those feelings of profound loneliness or isolation. And yeah, when I would have some days off, I would spend a lot of it inside, and when I would come outside, I'd feel just kind of completely dazed, kind of reacting very acutely to really benign situations, which did nothing to help me think that, I would dread a resus situation, because there was times where I felt like even going into a shop was anxiety provoking. It was mad. And how can you have a clinician that is that sort of brain fried? How are they going to deal with the pressures of a resuscitation or anything like that? And I feel it's something we sort of bear that burden very personally and hide away from accepting it a lot. And I don't know. Yeah, the sort of public perception has to change. The society's perception of what it means to have this, it's important to have a diversity of human emotions, and sadness is just as important as happiness. And I think, but we still have this very stigmatized view of the need for sadness.
Yeah, absolutely. I mean, it's coming through now with the current pandemic situation. The public are seeing the humanity of these so-called, strong pillars of society, i.e., doctors, and they are falling away by the wayside.
Yeah,
and people are realizing, oh, they're human beings, and they need our support as much as we need their support. Given that we've got social media, it's much more open and people can say whatever they want. Well, actually they can't, because of all this cancel culture and so on. But then, you've got to develop thick skin, raise your voice and say what's inside of you, because that's, that's what defines us as human beings.
And I point to in the midst of my CMT being the first point that I was brave enough to really call it out and say, I can't do this. And it wasn't a breakthrough moment. It was just a sort of collapse of confidence, which again was triggered by feeling a little bit overwhelmed. And it was during a difficult resuscitation of a young person. We weren't able to resuscitate them. And it wasn't that I felt necessarily upset by that experience. It was that I was conscious of the fact that I didn't really feel anything. And I thought, oh, that's not right. I should feel bad. But the sort of candle flame just kind of flickered out at that point. And I was just very much a medic zombie, very much just dragging myself into work and doing the deeds. But it was only towards the end of my CMT1 where I had my supervisor going through my portfolio as part of my portfolio review. He was saying that actually it was devoid of any work. Pretty much since that point of having that difficult resuscitation, I just dropped the mic on the whole thing. And he was surprised, because prior to that, it was a glowing CMT1 year. Lots of reflections and
could you remind me what CMT means?
From staff. Sorry, it's a core medical training.
Right, yeah.
So it's the preamble to your medical registrar years. Right.
Even more stress.
I know. And so that was the thing. So I went into CMT, I kind of felt like I fell into it, because I had this maybe outside external expectation. I should know exactly what to go into. And I got towards the end of FY2 with no real clarity. I went into a clinical teaching fellowship job, and then felt again towards the end of that, this pressure to finally find the thing that I'm going to do for 30 years. And it often feels like that, and you've got this whole weight on your shoulders there. So to be in the middle of CMT and realize the flame's out, and this light at the end of the tunnel seems so far away. And what is that light at the end of the tunnel? Becoming a medical registrar? Oh no, becoming a consultant in a field that I don't know what I want to be in? No, this just sounds awful. So, you know, I kind of brought that conversation into the fore with my supervisor. He was very surprised that I had doubts about my training, and he thought, right, how can we help you continue? You know, so he was quite close-minded into how he thought his role was. So rather than being more pastoral, it was proactively thinking, how are we going to make it to your CMT2? How are you going to pass?
Yeah.
Whereas I think actually what I needed to hear was, there are options beyond this training. It is possible to resign.
Yeah.
And I didn't even consider resigning a possibility until I worked a shift with a locum doctor, and he said, you know what, it just sounds like you need to bow out here. Why go into a second year of a training program that's not fulfilling anything for you, and you feel,
well, that's killing you,
don't
really.
feel human. Yeah, it was slowly but surely. And after that point, I really fell back into medicine, because fell back in love with medicine, because I started locuming. I was able to define my hours, how I worked, when I worked, and that, you know, so working Monday to Friday, 9 to 5 job. I was able to see my friends again. I was able to meet my Swedish girlfriend and develop that relationship, and now she's my fiance. And I think if I'd gone into the role of being a medical registrar beyond that, no chance. You know, and then just developed a really full and diverse life, and, you know, brought into life the Medizom concept, feeling that very palpably, the sort of the wrongs of the training world. And I went to New Zealand, was a medical registrar there. We'll just skim past that.
But you know,
and then
a medical registrar in New Zealand is different from a medical registrar in a really busy,
hugely
hospital.
different. Yeah, because you can still bring you to work, because the culture in the New Zealand hospitals is much more of collaboration rather than competition. So I felt, and didn't feel the need to have my please and thank yous in New Zealand. I felt, you know, I didn't feel confined into this rigid perception of what I felt a medical registrar should be. I just turned up as Ross, and
sexy Ross,
engaged. Yeah, sexy Ross, if you will. Yeah. And patients seemed to like that, you know, the fact that I was, you know,
the sexy Dr. Ross is here.
Or, yeah. So
yeah, I mean, you know, what you needed at the time was a supportive voice at the time of your despair. And if you would have got that supportive voice, your trajectory would have been totally different. Yeah, you know.
Yeah.
I mean, you know,
but again, grateful for that. So yeah, just again grateful. And I think that's the thing that, yes, in the midst and the heat and of all that, it felt like, what hope is there in this? What good is going to come out of this? But now, again, can say that's when I was learning the most about myself.
Yeah.
And readjusting to becoming more resilient to not allow that to happen in the future, you know.
Yeah, I mean, my point of that is that some people are not as lucky as me and you and sort of find the light. Some people just keep going into the darkness and eventually, you know, have mental distress or suicide, or, you know, they don't come out of it. You know, that's the, you know, one of the consequences or one of the risks. You know, if our resource structure is not supportive enough or not humane enough. And that's something that I hope that the medical leadership take into account seriously.
And I think it's even more of a possibility of reaching those true, real crisis points in a pandemic world, particularly, you know, our ICU colleagues who are expressing huge high levels of burnout. So
yeah, I mean, the last thing they need is, you know, what can we do for you to keep you going? You know, that's the last thing they want to hear.
Yeah.
Coming back to your word of a pastor, because that's a really powerful word, and it's something that
Mm-hmm.
you've been, let's say, swimming in, because your dad was a pastor. Is that right?
That's right. Yeah, he was a minister, Protestant church, up until I think, how old was he? Yeah, maybe mid 40s, and then he saw the light and became a computer software engineer
Oh, the
instead.
computer lights.
So
You
he
saw the computer lights.
yeah, yeah. But that was a really, like, I really value that experience of growing up in faith, in terms of the fact that I was exposed to different generations, different backgrounds, and I think that did have a bearing in my ability to I feel easily talk with whoever, because I wasn't afraid of speaking to an old person or whatever. And sort of seeing that important pillar in society, someone that would be at the hospital bedside. Dad would be called out to hospital to say, well, I don't know if it is the last rites in Protestant faith or not, but whatever, providing some sort of spiritual component to someone's experience of dying, and I kind of hugely respected that. So I think that sort of pastoral element has come through in what I do. In all my teaching roles I've had, I think the thing that I've enjoyed most is being able to offer some insight to the students or whatever, into really what their perspective is on the whole medical career field, and making sure that it's they're considering it from what their real values are, what they consider their purpose to be or not be. So
Yeah, I mean, it's really interesting. And, the other advantage is you can talk about religion, and there's a massive subset of the population who don't talk about religion because they consider it a hot potato. But really,
yeah,
the early forms of philosophy in human history was religion. It's a form of philosophy. And I
yeah,
think the more you philosophize in life, the better. I mean, that's the saying in marriage, the longer you are married, the better philosopher you become. And I think that's
yes,
really, just to give you a bit of advice, given that, sort of starting your journey in long-term relationships,
yeah,
you become better at philosophy.
You really got to hone in on the on all that, definitely.
All the deep stuff, none of the superficial stuff.
Yeah, yeah, that's it. I mean, I maybe don't bring in religious aspects to a lot of my work, but there's definitely a spiritual component. Like, I remember when I was working as a locum middle grade up in the Highlands, there was this guy, a middle-aged guy with alcoholic cirrhosis, who was slowly but surely dying with needing lots of paracentesis almost weekly, and it was a really sort of sad situation to see. And he was really scared by the concept of death, and no one had. I think we'd been seeing it through the lens of, as doctors, thinking, right, he needs his ascites drained weekly. I was like, well, actually, this is just his life now. He just comes week on week, and then he'll get a complication, then he gets a pneumonia, then he's a little bit worse. What's his quality of life here? And his family had no insight into the fact that this really was looking quite bleak. Members of his family were saying, you can still get a liver transplant, you just need to. So it was really heartbreaking. But actually, I shared with him an episode. I gave him my iPod, I remember, which had John O'Donoghue recording on it. And he's like he was an Irish mystic philosopher. He unfortunately died last decade in his 50s from cancer. but he talks really poetically and succinctly about the journey of dying, and he really appreciated that, just in the dark of night in the hospital ward when there's 6 other patients coughing and spluttering, to just hear words of comfort and beauty and poetry, that, you know, often it's just devoid of any sort of, that hospital experience is just horrible.
Yeah.
So he, you know, I think it, and I felt, you know, really kind of elated in myself, and, you know, like kind of redefining the concept of what my role should be, and as a caregiver, and also as a provider of ways through things. And that's the beauty of medicine. It can be, if you want it to be, it doesn't have to be pill pushing all the time. It can be about recognizing what the needs of a person is, and that might be spiritual or otherwise.
Yeah, and you know, if you look at the history of our forefathers in terms of the medical profession, you know, they were philosophers and spiritual people, and linguistic individuals, as well as anatomical and physiological and pathological. And I think, you know, separating the two has its disadvantages, which is what we're seeing now, you know, where our hospitals are sterile and clinical, and, you know, devoid of that importance of giving solace to our patients.
Mm-hmm.
You know, I think that is important. I mean, I come from a very religious background, and my conflict was, I thought, no, you know, I need to be scientific about this. I need to be academic about this. I need to be very logical and rational about this, which got me to a certain extent. But I found that I needed to go beyond the sensical and into, I mean, I won't call it nonsensical, but it's metaphysical. And, you know, metaphysical is so much vast than the physical. I mean, you just have to look at the universe. Most of it is made of what they call dark matter, rather than matter. I mean, what's that about? You know, we don't know. And, you know, this whole thing about the immune system. I mean, I don't know about you, but one of the two difficult topics that I had difficulty with in medical school was neurology and immunology. Because the professors didn't really have a clue, and they'd overcomplicate things. And now we're going through a pandemic, and no one knows what's going on. So it's all a bit of a mess, really. You know, science is not really giving us the answers.
No, and the pandemic again is one of those things you can't label it as good or bad, and obviously so much about the pandemic is bad, but through that it's really kind of brought to the fore it's catalyzed a lot of things, exposed a lot of things. It's like a sepsis. It's like showing the diseases, like the health inequalities, the poor government, the lack of pastoral support for doctors, particularly, and actually, you know, it's comforting to see now when I go on to my weekly training email, there's a huge amount of resources there for trainees about emotional well-being, self-referring to psychological services. I think that's a huge positive change, and a really unexpected one. So I'm like really pleased to see that just being normalized. And even in the emergency department, in our morning handovers, at the end of the handover, they just make the point, the ED consultants will make the point of sort of signing out when you finish your shift, and think about one good thing that's happened, one check up on a colleague. So I think there are definite major progressions that have been helped along by this horrible situation that we're in. So
yeah, I mean, you know, that's the power of human adaptability and human evolution. I think, you know, the more strains that are put on us, a lot of people do actually get stronger. You know, if, you know, as you said, if you're aware of it, you know, if you're conscious of it, if it's a conscious process.
Yeah. Which is, I think, what ultimately my concept for Medizom is about. Is kind of being comical about it and saying, look, we're all medic zombies.
Yeah.
We're in the middle of a medic zombie apocalypse. We're all kind of shuffling along. And you know, I think.
But some of us are more sexier than others, of course.
Some, yes.
Yeah.
Yeah. And you're, you know, I mean, the sexiness comes out when you're confident.
When you're yourself.
Yeah, when you're yourself. I mean, I think I'm happy to just be me. But if you were talking to me 3 years ago,
yeah,
you know, I'd be a sort of blubbering idiot because I was just kind of,
it wasn't you.
Didn't know who I was or what didn't know what my role was, or I mean, I still don't know what my role is, and I think that's kind of, it's kind of loving that. It's because there's less of an ego there now.
Yeah,
like I don't see that I've got some sort of defining purpose, and just, you know, I just take more time to not constantly do. I think that's really hard to stop doing in a pandemic, because you always feel like, well, I want to keep busying myself because I don't want to think about the emotions running underneath that, but actually having a time to have a to-be list, whether like having a nice hot bath and just listening to some music or reading a book, and just the simple pleasures and how great those are, without like feeling the need to be on LinkedIn all the time or social media all the time. And so
no, I mean, I absolutely agree with you. You know, I've stopped doing, you know, the whole rat race of marketing and and this and that and the other, and just doing it because you know it's the right thing to do for yourself.
Mm-hmm.
And you know, you're not voluntarily harming people. Or harming yourself. I mean, you can harm yourself. I mean, there's nothing wrong with harming yourself. You know, there's a whole masochistic movement, and sort of good luck to them, sort of thing. But hey, you know, horses for courses, as they say.
Yeah, I feel like my harming myself situation, it didn't come in the way of like drugs and alcohol and, you know, or like prostitutes or something like that. For me, it was like watching loads of YouTube videos, like really dumb videos. I'd spend hours, like when I was feeling like particularly bad, you know, I wouldn't get up in the mornings. I get up at like 11, 12 o'clock, having watched 3 hours of blooper reels, or just because it was like that little dopamine pleasure trickle coming into my brain that was just enough to numb the pain that was there. Kind of horrible, isn't it?
So who helped you? I mean, was it your lovely girlfriend that kind of got you to see yourself again, or what sort of got you out of, what was the biggest thing that lifted you out of the swamp?
I've been in the swamp quite a few times, you know. So, you know, that core
what works for
team,
you, you know, lifting you out of the swamp, what works for you?
Well, it has been different things at different times, and the first time my girlfriend wasn't in my life, and I think certainly that is a contributing factor to have someone that loves you and fulfilling more things where you're displaying love to someone else on a regular basis is really helpful as well. And it's made the pandemic so much easier, because there's been times where I was in the midst of training which felt far lonelier than the pandemic ever did, which is kind of ironic. I think more than anything, it was taking action, and it sounds so cliched, but like when even like, so getting properly honest here, I went to my GP, and because I was at a loss to what to do, and I was put on some sertraline. I took it for a week. I decided like it did the job. I was suddenly being able to cycle at 5 a.m. And of course, it had nothing to do with that. Like, you know, an SSRI or any antidepressant doesn't have any effect within a week. But I think it was just solely that act of feeling like I was doing something to change what I was doing. That was the first sort of domino step in progression. So then I was exercising more, and I think if you can ensure a healthier body, it helps ensure a healthier mind. And then, you know, actually last year was a huge kind of difficult transition. Just after sort of 3 or 4 years of being a locum doctor, it's a very solitary position. You're never really part of a team, and that kind of got to me in the midst of COVID. I actually got some counselling, and that was, I just wish I kind of done that so much sooner, because and again, I'm trying to talk about it really casually, because it actually should be something that's like this, you know, like how we get personal training when we're not getting our achievements with our body when we're working out. Well, have someone that's got 20 years of experience in how to like challenge your thoughts. And it's meant that I've not felt like I need to have all these conditions to functioning as a human being, or being happy, or even that happiness is the thing I should be attaining. Which meant, you know, having that element of counselling before starting 6 months in ED in the midst of a pandemic were actually amazing. I loved the experience. And I don't think without having that challenge of who I was, or what my sort of perfectionist tendencies were doing or not allowing me to do, without challenging that, I would have hated ED. So I think it's, yeah, so in summary, I think it's a combination of ensuring physical well-being, getting out in nature, simply doing a little bit and being quite forgiving with yourself, and seeking help, be it in your support network or professionally. And I think at last, access to those professional bodies is becoming more commonplace and more expected. So
yeah, no, I mean, you're absolutely right. You know, these drugs don't have agency. It's you that has agency. You know, you decided that
they numb you, and they kind of get you below thought a lot of the time. You know, that's something that Eckhart Tolle says. Like, he's my spiritual guru for sure. But all these things, TV, alcohol, drugs, antidepressants, they get you below the level of thought. And actually what you want to do is challenge those thoughts, or even get above it to a point of mindfulness and presence, and allowing those thoughts to be there, but not engaging with them in a way that says that they're true fact, and that you have to believe every thought that comes swimming into your mind. So,
yeah. In the position of spirit, and you know, we're all connected in spirit, really. We're separated in mind to a certain extent, and definitely in body, but in spirit we understand the human spirit. You know, we've heard of lots of narratives of the human spirit overcoming all adversity. You know, and that gets us, you know, it's not a logical thing, it's not a cognitive thing, it's a spiritual thing. But hey, you know, I'm biased because it's a surgical spirit, isn't it? You know,
yeah,
proper bias.
No, it's totally true, because then once you can you can broaden out that perspective of everything being about you, and just bringing a quality to your work which is more sort of perceptive of everyone else's being. It's really freeing, because suddenly that sort of huge spotlight that might be on you and how you're being perceived is, you know, thinking about, oh, what's their jam? Why is that consultant shouting to that junior? And you can kind of figure out their where they are in their level of consciousness.
Yeah.
If they're completely, unconscious to the fact that their words are unhelpful, or and then you can forgive them, because it's saying, well, they, forgive them for they know not what they do, kind of thing. It's
these are all spiritual, concepts. Just like when we started, I'm jealous of you, which is totally spiritual. I'm still jealous of you, but I'm working on that. Obviously, I'm not going to tell you that everything else, because I've got such a big ego, and that's okay. So what's your, because we've been for an hour, we could really talk for a lot longer, and we'll, maybe we can do this again at some stage. So what would your advice be to the people who are listening to this are sort of doctors that have young children who want to go into medicine, and obviously these doctors trained in medicine in a different era and in a different time, and they've got young adults now who are about to go into medicine. What would your advice be to them?
I think it's not to rush. I don't think it served me well to go immediately from high school to straight into university, to then be at the point where at the age of 22, 23, being thrust into really challenging circumstances. For some people, it's absolutely the right thing, and they've got the right head on their shoulders to deal with the great difficulty that comes with that responsibility for a human's life. But I think that is the exception to the rule. There are many people that could do themselves a lot of service by traveling when pandemic isn't here, of considering different industries as well. I think some of the best doctors out there are ones that have come from different industries first, who haven't just thought of, well, I've got the grades, so either I'm going to be a lawyer or a doctor. I hope we're getting away from schools' career departments kind of saying that as a be all and end all, but really doing something that chimes into who you are, and not being forced and feeling any sort of external pressure. So the fundamental reason for going into medicine shouldn't be because there's parent expectation. I think that's just setting yourself up for complete failure, and potentially, disaster for patients if that is your only reason and you feel resentful in some way for the position that you're in. So yeah, trying to keep the answer simple. I think it is just gaining as much life experience as you can, and ensuring that the origins for your reason for choosing medicine are deep and not from an external source. It has to come from really within. And I definitely felt I had that, having done, I did work for cooking for the homeless before going to school. I was a healthcare assistant between the ages of 16 to 22. So even going into medical school, I kept that going and would do that in the holidays. And that's not to sound like Miss Universe. It's just that, I kind of knew from my dad and from just kind of getting my kicks from helping others, and I knew it was for me. So if your intention is good enough, then you can do it from a young age. It's all about intention, I guess.
Wonderful. It's been a great pleasure speaking to you, sexy Dr. Ross. And
I think next time I'm going to have to keep my video off for you, you know?
yeah, get me aroused even more, is it? Yeah. Increase my arousal. That's not fair, actually. Yeah.
No.
But then
when I'm talking to you, it does feel like you are the enlightened one as I'm seeing the aurora glowing behind you.
It's a trick, mate. It's a cheap trick.
Yeah, well, it works.
It's a cheap trick. Thank you so much, mate. It's been a pleasure.
All right, no worries. Yeah, it's been good. Thank you.